You may recall that one of the initiatives that we have introduced in this second phase of the vaccination rollout and subsequent phases is the Primary Healthcare Services Integration, PSI, also known as the whole of family approach. This means that when you visit a health facility for your COVID-19 vaccination, you will be given health talk to improve your knowledge of the vaccine and vaccination. And if you are above 40 years, if you're 40 years and above, you will have the opportunity to check your blood pressure and be assessed for the risk of diabetes. Similarly, children aged 0 to 12 months will be screened for malnutrition and vaccinated against childhood diseases such as measles, yellow fever, hepatitis, and poliomyelitis. If you need further medical attention, you will be referred to the appropriate hospital for additional analysis and treatment. That every person aged 18 years and above who has not been vaccinated should visit any of our vaccination sites to receive their first dose of Moderna vaccine. Those who have received their first dose of AstraZeneca should also proceed to their vaccination sites for their second dose for complete protection against the virus. Please remember that even after vaccination, we still need to continue observing non-pharmaceutical measures such as the wearing of face masks, observing hand hygiene, physical distancing, and avoiding crowds and unnecessary travels until the country achieves herd immunity.
So all those of you who have taken the first dose but have not taken the second dose, please go for the second dose of AstraZeneca and contact your nearest health center. The second important constituent is the health workers. As the footfall of patients is increasing in the hospitals, you are furthermore exposed to risk of coming in contact with COVID. So please do not defer your COVID vaccination. Do not have apprehensions about its safety. Please take the Moderna or AstraZeneca vaccine as appropriate at the most immediate point. The third constituency which we would like to reach is the 2.5 million people who have safely taken AstraZeneca vaccine, and they should be the brand ambassadors to say and mobilize their own community. If one person brings one person, there will be enough people for the phase 2 for the vaccination. So please, if you can reach out to your community, assure them that you have taken the vaccine and you have not faced any major side effect. This will install a lot of confidence. The vaccine is available in enough quantity for phase 2. The vaccine is safe. The vaccine is effective.
Untoward side effects. We have vaccinated over 300 million people with the COVID-19 vaccine. And look at the very minute number of people who have had side effects relative to the people who have received the vaccine. That right there is the evidence that you have to ensure you have the correct information that you can send to people, that the vaccines are safe and effective. Over 300 million people and comparatively very few side effects. And you are approaching a year of these vaccines being administered right from the United States to Europe. So what other type of long-term effects are you talking about? When you've stayed this long without these side effects, it's very unlikely that you will see other long-term effects, right? So despite that, it doesn't mean that we will not continue to gather information about the effect of the vaccines. But I think we've seen for long enough that these vaccines are safe and effective, and this is what has guided the Food and Drug Administration of the United States, the FDA, to give full approval, right, to the Pfizer vaccine. Initially, they gave just emergency use authorization, but after the data that has been collected, the massive number of people who have been vaccinated with very little side effects, there is now evidence that the FDA was able to use to grant full approval to the Pfizer vaccine to be used. So we feel pretty confident based on the clinical trials that have been conducted, based on the number of people who have taken the vaccine, even in Nigeria. Look at the number of people that have taken the vaccine, and people are going around like, what long-term side effect are we talking about? I took the vaccine and I'm as healthy as ever, right? If you are worried about a long-term effect when somebody is 100 years old, let's talk about it then, okay? But right now, I think it's not something for you to worry about.